I attended the University of Texas at Austin, got a bachelor's of science in pharmacy, worked full-time as a pharmacist for a while, and initially during medical school at Baylor College of Medicine in Houston. Decided that I wanted to do general surgery. Actually wanted to be a heart surgeon at first. In medical school I wanted to be a brain surgeon, and then I changed to heart surgery. And eventually during my residency at the Scott and White Clinic in Temple, Texas, which was affiliated with the Texas A&M University Health Science Center, I decided that oncology was what drove me most. I then began a 3-year fellowship in surgical oncology at the University of Texas MD Anderson Cancer Center in Houston. I joined Surgical Clinic Associates and the staff of Baptist Hospital and began building my practice. I, for a while, was the state chairman of the American College of Surgeons Commission on Cancer. My practice got so busy I had to pass that responsibility to a surgeon in another part of the state. After about 8 years, I decided to focus more on breast oncology, and that now comprises about 80% of my practice. There's a lot more research going on in breast than any other facet of oncology. It changes more on a daily basis. There were a lot of things changing surgically. In 1998, 2 years after I came here, we initiated sentinel node biopsy for breast cancer. I was the local study director for the University of Louisville Breast Cancer Sentinel Node Registry. It was a study that eventually resulted in my co-authoring about 8 papers in major peer-reviewed surgical journals. Baptist Hospital was the lead institution locally for that. There have been some other developments in breast surgical oncology that have just really kept it interesting and fun. It's a very emotionally charged cancer. Generates a lot of public support, a lot of media attention. People are surprisingly informed when they come to the office and want to ask questions about their breast cancer because they've already been on the internet and have done their own research. A substantial number have. So I really feel like it's a place where we have the opportunity to make an impact. For many years, breast surgery was kind of considered to be technically mundane compared to some of the other things we do in surgical oncology, but that's really not true anymore with sentinel node biopsy, with a technique we use called brachytherapy, oncoplastic breast surgery, all the various reconstruction techniques we use now. We use a lot of preoperative chemotherapy to downstage people to facilitate preserving their breast. There's just a lot of interesting things going on in breast oncology that don't. Similar things are going on in other areas of oncology, just not at the same pace. And also it's not the same volume. It's a relatively common tumor, and so you see a lot of patients and you get to apply those techniques to a lot of different patients. My job is to, in a way, be their teacher and their mentor. I mean, be their surgeon, but to be their teacher in a way and inform them about what they have, what they can do about it, and to help guide them through the decision-making process, and then guide them through treatment.